information only, as we do not have a quorum tonight. And so there'll be no approval of the minutes. And moving on to meeting, public comment section of the meeting. Of course, this is the time when we set aside for comments from the public who are asked to limit their comments to 2 minutes. Any person interested in providing a public comment should email publicmeetings@rockyhillct.gov, and you will be provided with a link to attend the Zoom meeting remotely and instructions on how to participate. I don't believe we have any tonight. We are moving on to department updates, starting with fire. I will note before we go to the fire report, the public comment, we have questions from, we have a set of questions from Krista Mariner that will be read in with the report from the Central Health District. So that's why we're letting Charlie read those in. He does have them. He's had them ahead of time, and we'll go with that at that point. Fire department.
Okay. Thank you, Ed. Excuse me. I just hit a couple highlights on our report, and the incidents we responded to were 58 for a yearly total of 626, and which is slightly less than our 5-year average of 666. Our training hours were 210 and a year-to-date of 3,800. No injuries reported. Year-to-date, 2 injuries. Our staffing, a little lower because we have 4 people out on FMLA, but we're at 71 total with 64 active. Okay. We're still in beta testing with our accountability system, and we're probably going to push that back a couple of months before we start it up, as there's just a lot of moving parts to it, and we want to make sure our operational policies match the system, and we train to that. A couple other quick things. For the year-to-date, our fire-related incidents we responded to were 120, or 19% of our calls, with our rescue services at 116, which is 18.5%. Hazardous conditions, we responded to 81 for 13%. Service calls, 69 for 11%. Good intent calls, 71 for 11%. False call or false fire alarm, 164 for 26%. Severe weather, there was 1, but we did have a few storms, so those will be found in hazardous conditions or service calls. And our average attendance on the 626 was a little over 18 members, and total attendance for the year, and this is the amount of times the members have left the house to go to a call, was a little over 11,000, 11,134. With that, the fire marshal's report, and I see he's on here, is in here. And if you have any questions, I'm sure he'd be available to answer. And that's about it. Had all that good data for Punkesh.
I know. Before we jump on, just the only time we got to ask you about your water rescue, which I know was multi-departmental, but I think it's probably good to ask you about that. We talked about it at the Emergency Operations Committee briefly, but I think that was a highlight for you, for all 3 departments to help with that. And did we get the vehicle out of the Connecticut River?
That vehicle, I hit the short answer. That vehicle's somewhere down there still.
Really?
Yep. We saw no evidence of its location at night. No bubbles, no oil slicks, anything like that, and the river wasn't moving too fast. And if you remember, that was a Tuesday night, I believe, Thursday or Friday, it started raining and rained for 3 days, and that river just came right up. So it's just too dangerous to go look for it now, too cold. We've had several conversations with the Coast Guard. I've also had several conversations with Rocky Hill Police Sergeant Morgan, who's a trained diver who works with the local dive team, about looking forward in the spring. And I've reached out to Glastonbury Fire Department, who has side scan radar in their rescue boat, which they'd be happy to run over for us when the time is right. So we have the tools and we have the players in place, but still a little too early to put the plan in place to go out there looking for it. And I think at this time, it's the Coast Guard's responsibility to manage the removal.
But just for those that are watching that don't know, we had a vehicle with an individual driving into the river or lose control of the vehicle and end up in the river, and fire, EMS, and police were on the scene in what, less than 5 minutes?
Yeah, it was police were pulling in as the vehicle entered the river. It was on December 22nd, I believe, a few minutes after 6. The man did exit the vehicle, and now he was in the river about 60 feet or so off the bank. And it was cold then, and the first 6-8 feet of the shoreline was ice at that point. The PD tried real hard with their rescue lines to reach him. He was just a little bit out of range there. We were called immediately, as was EMS. Our crews were set up within 9 minutes of the call. We had 2 members initially in cold water rescue suits, followed by a backup team of 4. They took the Zodiac inflatable boat and the boat got hung up on some ice, and one of them, and they could see the man about 60 feet out, and he was clinging to one of the pylons, or dolphins as they're called. And he was changing color. He didn't look like he'd last too long. So one of the members, firefighter Ed Kelly, took it upon himself. He went in the water, swam over to him, got a hold of him. At that point, firefighter Bill Kelly, his brother, was able to maneuver the 11-foot inflatable boat to him, and they were towed back to shore. The man was transferred right after that to EMS, who transported him to Hartford Hospital, and he was discharged from the medical unit 4 days later. I did happen to, all by accident, I didn't know him. I do now. I ran into his 2 sons, who came over and introduced themselves, and they were incredibly thankful and grateful, and a lot of appreciation to all the services and all the people involved.
Thank you for that. For that information. I can tell you or relate that Wethersfield and Glastonbury are on alert as well and have had some incidences as well. So we appreciate you guys getting down there in a hustle.
Thank you.
Since there are no questions, we will move to Fire Marshal.
So you have the report for the inspections for the month. It's down a little bit because of the COVID. We're not allowed and not able to get into a lot of the facilities We have stopped doing the remote inspections for the commercial properties, and we are doing actual inspections for anything new. But other than that, it's kind of business as usual.
And fire marshal helped participate with the pop-up COVID testing site this month as well?
Yeah, I was going to cover that. But yeah, we secured a site for the COVID testing. It was done last week. It's going to be done again next week on, I believe, Monday at Elmridge Park. These are not the rapid tests, but it's the PCR test. So if anybody needs, the test, to get down to the park, and it's open from 8:30 to 1:30 on Monday, I believe.
Thank you.
Monday, the 25th,
Yep,
I'm sorry, the 27th. Yep, 27th,
25th.
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 Sorry.
Yep.
We're gonna jump to ambulance.
We've been doing great. Let's see, we had 394 calls for the month of December. For the whole year, we had 4,191 calls. Membership's holding strong at 81. We have 2 new members in the process of getting their backgrounds done. And I did end up with one of our people did test positive for COVID right after they received the vaccine. And we're in the process of, she's been isolated, and fortunately it was prior to her coming on shift, or 2 weeks before her coming on shift. So there wasn't any incidents as far as any of our members coming in contact with her. But other than that, everybody else is doing exceptionally well. She's doing well, and we're doing great.
Thanks, Joe. Police.
Okay, good evening, everyone. Total calls for service for the month of December were 2,876. We had 13 criminal arrests for the month and investigated 38 motor vehicle accidents. 22 motor vehicle infractions were issued, and an additional 12 warnings were issued for the month. We had 189 training hours for the month of December. This morning we hired a new certified officer. So that brings us to now having 2 vacancies to fill. And happily we have 2 officers, certified officers, I should say, in the pipeline. We're doing the background. We're nearly complete with them. They will be coming on board in February. So again, happily, I can say that by mid-February, we should be up to our authorized strength. However, as I say that, we just received a retirement notice effective May 1st. So the hamster wheel continues, but we're in pretty good shape as we report here today. I do have 1 officer still in the academy who has roughly less than 2 months to go, and then he will be here as well. Other than that, not really much else happening. No quarantine issues to report. Everything else seems status quo. That's basically all I have.
All right, I still am receiving calls weekly regarding, the one-off vehicle theft issues. One Volvo stolen right out of the garage. But again, people are leaving their fobs in the vehicles. But so it does still seem like that's still percolating out there. And I can relate that I can relate that cost, Betsy Gara, I guess the executive director at Cost, is taking up the issue. So this is the, John, help me out here. Cost is the Association of
And Connecticut, small towns.
Connecticut
I think
Small
it's less than
Towns.
30,000 population.
And they are going to be bringing something to the Capitol, I think, as well as maybe CCM. So everybody's trying their best on that issue, I think. Thank you, Chief Custer. I'm going to jump to emergency management.
Good evening. And just to reiterate with what Rich and John said, the testing site is on Monday, the 25th, at Elmridge Park from 8:30 to 1:30. And there's no reservations needed. So emergency management has been continuing with the COVID EOC meetings, ongoing once a week with everybody. Nothing new to report that hasn't been reported already. With the EOC, the state of Connecticut puts out a $1,000 grant for PPE for EOC personnel. So I put in for that last week. And then there's other grants that we're looking at that needs to be done. We're going to be meeting with Central Connecticut Health District for a vaccination site on Thursday morning in regards to what would work and what their needs are. And the last thing I have, I'm going to steal a little bit from Charles here, is that anybody age 75 and older are now available for vaccination, and they can get it through either a healthcare provider, such as like Yukon Health, Hartford Healthcare. They can go through the state's vaccination administration management system, and that can be found at ct.gov/COVID vaccine. And for anybody who does not have access to a computer, you can call the Connecticut COVID Appointment Assist line. And that number is 877-918-2224. And that's open Monday through Friday, 8 to 4:30.
Can you restate that hotline?
The hotline number is 877-918-2224. And that's Monday through Friday, 8 to 4:30. For
And what's
anybody
it
that doesn't
called?
have computer access.
Yeah, what's it called again?
Connecticut COVID Appointment Assist line.
I believe we may have had somebody sit in on the central, on Connecticut State Fire Watch Command Center in Middletown.
Not that I know that Rich got an email. Rich, are you there?
Yeah, that was on Sunday because of what was expected at the Capitol. And I just sent that out to everybody that I thought was, needed to know.
And James, you alerted me to the webinar. I think you attended. I attended on COVID-19 vaccine communication reliability and combat of disinformation, held by the National Press Club and Journalism Institute.
I signed up for it, but I wasn't able to attend it based on on stuff that was going on at work.
I only bring that up so Charlie knows that and we are, I don't know if we're falling down in some area of communicating out about the town's COVID response, but if there is, I'll gladly take your suggestions.
So, and Ed, that's all I have to report for tonight.
Thanks, James.
Yep.
Old business is an update from Central Connecticut Health District. Charlie, you're up. And this is where we will get in Krista Mariner's public comment or questions. Thank you, Krista.
Okay, so let me go ahead and bring up the questions. So first, what are the current counts for Rocky Hill, including fatalities? So as of the latest data that we have, which is from the 18th of January, the total cases for Rocky Hill are 1,253 confirmed cases. Total deaths in Rocky Hill is at 106 at this point, 106 fatalities. The second question she had was, the numbers have gone up steadily over the past month. What are the most significant contributing factors, such as small gatherings? Really what we're seeing right now is, I think, the contribution of the surge from Christmas and New Year's, from the gatherings that we've seen, at those holiday times. We have had some encouraging news over the past couple days. We've seen the numbers starting to flatten out a little bit, but there's still a lot of virus out within the community at this point. The majority of that is from the gatherings around the holidays, is what we're assuming. Her next question was, what role would CCHD be playing in vaccine distribution? When do we anticipate having vaccination clinics, since Connecticut has entered phase 1B? Currently, we just got the equipment to be able to order vaccine. So we're going to make our first vaccine order hopefully tomorrow. The question of whether or not we'll receive vaccine is really the question that's in my mind. We've had anecdotal, evidence from some of our other health departments that have ordered vaccine and not received any, or ordered vaccine and only received a portion of what they ordered. There's a limit to the number of vaccine that's coming into the state. We're only getting about 40 to 45,000 doses each week, and the number of clinics has started to go up and expand, which is a good thing, because eventually we'll have enough supply to be able to hopefully meet the demand that's coming. Currently within phase 1B, the only people that can be vaccinated are those 75 and above, and then anyone within phase 1A, which is the medical first responders. Governor did say this afternoon that they're planning on opening up more appointments to 65 and above here in the next couple weeks, and potentially opening up to essential workers at the end of February, beginning of March. It's easy to open up those slots, but without the vaccine, it's really just adding to the demand without opening up the spigot enough to be able to provide the supply. That's going to be the real limiting factor that we have. As James said, we had a quick meeting this morning to start the process of planning for where we will do vaccinations for both essential workers and looking at, other groups within the community. So once we do actually get some vaccine, we'll have a place and a plan to be able to get it out there. Currently, we can't utilize the same mechanisms that we've done in the past for flu. Last year, we did test out the drive-through method of vaccinations, and that worked very well. Did that at Elmridge Park for flu, but it's really kind of hard to do that in January and February. It's just too cold for the vaccinators. The one thing you don't want is have a vaccinator that's coming at you like this. So it's a little bit challenging. So we're having to look for some places more inside. So we spoke to the schools with potential to use the high school gym and some other sites. So we're having folks do some site surveys, talking about how we can actually utilize some indoor sites to be able to reach the populations that are coming up. With that being said, let me just make sure that I covered all the questions that she had. She did ask about the January 12th pop-up COVID clinic, to ask how that went. And I think, James, you covered that very well. So, I think we've answered all the questions. I do just want to say, even as these vaccinations are rolling out, and it's very important that people, when they do get the opportunity to to schedule for their vaccination, that they do so. Continuing to wear the mask, wash your hands, keep your distance is incredibly important. We can't let up right now. As this vaccine is rolling out, it's the combination of the efforts that's really going to help carry us through to the end. And that's my story, and I'm sticking to it.
Thank you, thank you. That's with the help of Krista Mariner, 58 Farms Village Road, Rocky Hill. Thank you, Krista, for those questions. Thank you, Charlie, for the report. Any new business?
No, I think we covered most of it with the vaccinations information that was given out throughout the meetings, as well as in search of a location in Rocky Hill that would meet it. Also, Charlie, what's also important is you need to have internet connection, which makes the schools better. And
Yeah, that is going to be a challenge. So I do have to say thanks to the superintendent, Mark Zito, and his crew. They've been very open to anything that we've needed. And hopefully, as we get ready to go into the vaccine in that setting, I'm sure they'll support us well.
Other business?
none.
And we don't need a motion to adjourn, I don't believe, John. So we will
You can close the meeting at 5:57.
closing the meeting at 5:57. Thank you, everybody. Gents.
Thank you.
Thank you.